We're talking about knee pain today, and the knee is a complex yet pretty basic structure. It likes to move in a uniplanar fashion, and it doesn't like lateral or medial movement, and it doesn't like to hold one bone stationary while twisting violently on the other. So these are the common causes of knee pain when the patient takes a vector force, if you will, from the outside in, and more rarely from the inside out. In football, we classically call these clips. But the other could be a hyper flexion and extension injury to the knee. So those are the types of things that occur at the knee. The knee may also experience a compression phenomena. This would be somebody who is in a motor vehicle accident and braces against the floorboard of the car and takes an upward violent impact pressure into the knee joint itself. Well, there are basically 4 questions that I ask for every knee injury. And those are, number 1, do you have pain going up or downstairs? Number 2, do you ever have a sense or an event where the knee just gives way on you? The third is, does the knee lock? And finally, when you had this event, did you hear a loud pop? So those are the 4 things that we ask about knee injuries. And then we do, obviously, the consultation and examination to ascertain what kind of vector force you took. But a lot of people will just say, my knee hurts. And there's an old orthopedic story about the person who goes to the orthopedic surgeon and says, doctor, my left knee hurts. He said, well, let me take a picture of it and we'll find out what's going on. And he comes back 15 minutes later and he says, well, Mr. Smith, I found out what's wrong with your left knee. He says, what is it? And he said, you have arthritis. And the patient looks at him and says, well, I have arthritis, but why does my knee hurt? He goes, because you're 65 years old, that's why. He says, so is my right knee, but it doesn't hurt. The moral of the story here is that sometimes, even though you walk on both feet, use both knees equally, there may be pain in one joint or the other that's not associated bilaterally. And that's an interesting phenomena of the arthritides, and we just have to accept that. But what do we do about these injuries? Well, the first thing is to return the range of motion to the joint itself. Now, this is assuming that there's no trauma where we actually had what we call a full thickness tear of the meniscus or an actual full tear to the associated anterior, posterior, longitudinal ligaments. So what we want to do is use range of motion exercises and return the range of motion. We also use a program that we call RICE, where we rest the joint, we ice it, we compress it, and we elevate it. Compression may mean bracing, but typically that's for an unstable joint. And we look at that, whether there's swelling or erythema in the joint, and we deal with that. We may deal with it with physical therapy modalities, but basically a knee responds best to rehabilitation exercises. So if you have these symptoms, we'd be happy to evaluate it for you. Give us a call at the clinic, and we'll be happy to take a look at it for you.